Eggs are a common food and highly nutritious. In the past, eggs have often been criticized for their high cholesterol content. However, there is no need to be overly alarmed. Recently, Japanese internist Dr. Takeshi Kurihara wrote an article sharing his experience with an 85-year-old patient, Mr. A. When Mr. A first came to see him, he looked very unwell and walked unsteadily. Dr. Kurihara advised Mr. A to eat more meat and eggs regularly. 4 months later, Mr. A returned for a follow-up, looking completely rejuvenated. Upon inquiry, it was revealed that Mr. A had followed the doctor's instructions and ate 5 eggs every day. Blood tests showed that Mr. A's albumin levels had significantly increased from a dangerous low. Dr. Kurihara explained that people with low albumin levels are prone to muscle atrophy and frequent falls, but albumin decreases with age. Mr. A successfully boosted his albumin levels by eating a lot of eggs, which made him more energetic. As for the common belief that eggs have too much cholesterol, Dr. Kurihara refuted this, stating that it originated in 1913 when a Soviet scientist observed a significant increase in cholesterol levels in rabbits after feeding them eggs. However, rabbits are herbivores, and consuming eggs naturally affects their health. In 1981, Japan conducted an experiment where healthy individuals ate 10 eggs a day for 5 days. The results showed that their cholesterol levels did not change significantly. Cholesterol diet misconceptions. A 50-year-old woman with no smoking or drinking habits suddenly suffered a heart attack. One reason for accelerated vascular aging, 5 foods to improve. Dr. Liu Boren, a PhD in nutritional medicine from Taiwan, shared on social media about a woman in her 50s who did not smoke or drink but suddenly had a heart attack. When seeking medical help, it was found that one of her coronary arteries was 90% blocked. Blood tests showed that her low-density cholesterol was far above the standard value. Dr. Liu analyzed that although the woman had no bad habits, her condition might be due to family history and the decrease in estrogen caused by ovarian function decline during menopause, which accelerates vascular aging. He suggested that menopausal women should pay more attention to a balanced diet, eat more fruits and vegetables, and foods rich in calcium such as beans, soy products, dark green vegetables, fish, and dairy products, which help maintain vascular health and reduce bad cholesterol. According to the Mayo Clinic, foods that can lower bad cholesterol include those high in soluble fiber, such as apples, bananas, papayas, and oats, as well as foods rich in omega-3 fatty acids like salmon, seaweed, and natto, nuts, and monounsaturated fats like avocados, dairy products, and meats, and whey protein foods like eggs, yogurt, and dairy products. Cholesterol diet recommendations. Which of the 3 common shrimp has the least cholesterol and lowest calories? Nutritionist advises avoiding 3 parts for better health. Shrimp, a type of crustacean, is a good low-fat, high-protein food. Taiwanese nutritionist Gao Minmin pointed out that although 70 to 80% of cholesterol is produced by the body, and only 20 to 30% comes from food, it is still recommended for people with high blood cholesterol to reduce saturated fat intake. Seafood is therefore very suitable for those with high blood cholesterol. Among the commonly seen lobster, prawn, and grass shrimp, lobster has the highest protein content and the lowest cholesterol. Gao Minmin mentioned that shrimp are nutritious but should avoid eating the shrimp head, gills, and intestines. If raised in water with high heavy metal content, shrimp will concentrate heavy metals in their heads, and the gills, being close to the mouth, are where shrimp filter dirty substances. Therefore, these parts should be removed before eating. The shrimp intestine, also known as the shrimp line, often contains leftover waste and should be removed as well. Cholesterol diet advice. Controlling cholesterol doesn't mean cutting out oils. Nutritionists' 6 recommendations for cooking with 4 types of oils. Many people think cholesterol is bad and believe it increases the risk of cardiovascular diseases. In fact, cholesterol is extremely important for the human body. Taiwanese nutritionist Pang Sheshan explained that cholesterol is essential for synthesizing bile salts, vitamin D, and hormones. Moreover, 80% of cholesterol is produced by the body itself, and only 20% is influenced by diet. She pointed out that healthy individuals do not need to strictly limit their daily cholesterol intake. However, people with high cholesterol problems can adopt some methods to help control cholesterol levels. Firstly, a high-fiber diet using unrefined grains like oatmeal and brown rice instead of refined white rice, noodles, and bread, and vegetables like dark leafy greens and mushrooms should be chosen. Avoid pastries and puff pastry, fried foods, and other items high in trans fats. Also, reduce cholesterol intake by avoiding fatty meats and organ meats. For cooking, use good oils such as olive oil, camellia oil, canola oil, or avocado oil to balance cholesterol. Regular exercise helps maintain metabolism, and discussing the use of dietary supplements such as fish oil, red yeast rice, or natto with professionals is also recommended. Health food warnings: can long-term nut consumption lead to liver cancer? Doctors warn of 6 cancers caused by diet. Dr. Zhang Yiqin, a Taiwanese hepatologist, recently shared a real case on a TV program. A woman in her 50s was found to have a tumor about 3 centimeters in size in her liver during a physical examination. Blood tests revealed high liver cancer indicators, yet she had no hepatitis B or C, and her liver function appeared normal, which seemed puzzling. It turned out she loved eating nuts, such as peanuts, and often bought large bags to eat slowly at home. This habit might have led to mold growth on some foods, producing aflatoxins, a class 1 carcinogen. Dr. Zhang reminded that aflatoxins are linked to liver cancer, so it is best to avoid eating stale foods. Additionally, he shared other cancers caused by diet. High temperatures in frying and grilling produce benzopyrene, which can increase the risk of colorectal cancer. Even non-smokers who inhale too much cooking oil smoke can develop lung cancer. High-calorie, high-fat foods increase the risk of breast cancer. Lastly, nitrites in pickled and processed foods increase the risk of stomach and colorectal cancers. Elderly diet: lack of folate increases the risk of dementia and death. Best ways to effectively absorb folate. A team from West Nishiyama Secondary College in the U.S. analyzed the blood folate concentrations of nearly 27,000 people aged 60 to 75 in a database and found that about 13% lacked folate. Those deficient in folate had a 68% higher risk of dementia and a 3-fold higher mortality rate. Although this is just an observational study, and folate levels vary with diet and metabolism, folate deficiency might become a routine check target in the future. Folate, also known as vitamin B9, helps bone marrow cells produce blood, aids DNA division, and supports nerve development. Therefore, it is recommended for women to supplement folate before and during pregnancy. Nutritionist Lu Maybao mentioned that in the past 20 years, many studies have linked folate with mild cognitive impairment. She suggested that each person should intake 400 micrograms of folate daily. Folate is found in dark green vegetables, beans, seeds, and organ meats such as spinach, leeks, soybeans, pumpkin seeds, and chicken liver. Since folate, like other B vitamins, is water-soluble, Lu Maybao recommended cooking vegetables for a shorter time by steaming or stir-frying to preserve more folate. Liver protection diet: 6 symptoms might indicate liver cancer, 15 foods to protect the liver and aid detoxification. According to reports, Lin Chioli, the mentor of singer J.J. Lin, recently passed away after struggling with cirrhosis and liver cancer for 8 or 9 years. According to Taiwan's China Medical University Hospital's educational materials, over 90% of liver cancer patients have chronic hepatitis B or C or cirrhosis caused by alcohol abuse. The liver has no pain nerves, so early liver cancer usually has no symptoms, and by the time there are noticeable changes, it might be too late. Symptoms like upper abdominal pain, bloating, fatigue, loss of appetite, weight loss, jaundice, lower limb edema, vomiting blood, and acute abdominal pain should prompt immediate medical attention. To protect the liver, nutritionists recommend 15 good foods, especially during the winter season for a thorough liver detox. Anti-metabolic syndrome diet: nutritionists' 3 principles for fighting metabolic syndrome. Eating 1 egg every 2 days lowers blood pressure. Drinking water effectively. Metabolic syndrome, including high blood pressure, high blood sugar, and high blood lipids, troubles many people. Improving health requires attention to diet, though many myths exist. Taiwanese nutritionist Yong Sihan provided detailed explanations, advising hypertension patients to control salt intake, with a daily recommendation of 6 grams, and adopt the DASH diet, focusing on fruits, vegetables, whole grains, and low-fat foods, including fish, poultry, nuts, and beans, while limiting high-sugar foods, drinks, red meat, and fatty foods. For those with high blood sugar, it is suggested to consume whole grains at meals to stabilize blood sugar levels. High blood lipid patients can actually eat eggs, but if concerned, they can eat one every 2 days. Trans fats and saturated fats have a greater impact on high blood lipids, so reducing fried foods and choosing lean meat over fatty meat is advised.